All right, let's talk about something big that's coming in 2026. A massive financial cliff is about to hit the US healthcare system, and it could mean your insurance costs are about to go way, way up. Now, this isn't some far off what if scenario. This is a real deadline that's getting closer every day. So, we're going to break down exactly what's going on, and, more importantly, what it could mean for you. So, let me just ask you this straight up. Straight up. What would you do if your health insurance bill doubled? I mean, just poof, twice as much overnight. It sounds like a crazy hypothetical, right? Well, for millions of Americans, it's not a hypothetical at all. It's the reality they're staring down. And see, this is the thing. This isn't just about a bunch of numbers or some political debate happening way over in Washington. No, this is about real people. It's about real families and the incredible stress that comes with trying to afford healthcare. Let me introduce you to someone. This is Aaron Lehman. He's a fifth-generation grain farmer out in Iowa. Now, his family gets their health insurance through the government's online marketplace, the website where you can shop around for different plans. And right now, they are looking at a potential price hike that is just staggering. We're talking more than double what they pay every month. Okay, let's actually look at the math here. Their monthly premium is on track to jump from about $500 a month to $1,300. Think about that. That's an extra $800 every single month. And for the Lemons, that's not just a number on a piece of paper. It means they have to put off crucial improvements on their farm. It's a direct hit to their family's livelihood. And here's the thing. The Lehman family is not some isolated case. They're just one example out of more than 20 million people all across the country. We're mostly talking about folks in lower and middle-income families, and they're all facing this exact same financial cliff. Now, the exact impact looks a little different for everyone, but it's always a big deal. Take Audrey Horn, a 60-year-old retiree in Nebraska. For her, it's a $300 a month increase. That means she's going to have to start dipping into her retirement savings just to get by. Or Andrea Deutsch in Pennsylvania. She's 58 and has type 1 diabetes. For her, this means an extra $160 a month for the insurance coverage that literally keeps her alive. So, what in the world is causing this massive price shock? Why now? Well, to get to the bottom of it, we have to talk about a policy that's been acting like a financial safety net for millions of people. And the problem is, that safety net is about to get yanked away. Okay, so at the very center of this whole thing are these enhanced subsidies for the Affordable Care Act. You probably know it as Obamacare. Now, subsidies is just a fancy word for financial help, right? Money from the government to help bring down your monthly insurance bill. And these subsidies got a major boost during the COVID-19 pandemic to help people get through that crisis. So here's the quick history. The original help started back in 2010 with the ACA. Then, during the pandemic, that help got supercharged, but it was always meant to be temporary. And that temporary boost has a hard expiration date, January 2026. And that's the moment. That's when all that extra financial aid just vanishes. And that's what triggers these massive price hikes we've been talking about. Okay, so the obvious question is, why not just extend them? If they're helping so many people, why let them expire? Well, the answer, as you might guess, comes down to a really high-stakes political standoff, one with very, very real consequences. And look, this wasn't some minor disagreement. The debate over extending these subsidies was so intense, so contentious, that it became a key sticking point in a budget fight that led to a 43-day shutdown of the entire federal government. I mean, that's how far apart the two sides were on this. So let's break down the two positions. On one side, you had Democrats, who were demanding that the subsidies be extended. They argued this was absolutely essential aid to help American families afford their coverage. On the other side, you had Republicans. They argued that the program was just way too expensive for taxpayers. And, they said, it doesn't even fix the root problems that are driving up healthcare costs to begin with. Things like the high price of drugs and medical procedures. And with both sides digging in their heels, well, there was no compromise. So, because of that political stalemate, the subsidies are now set to expire. Let's pull back from the individual stories for a second and look at the big picture, what this means for the entire country. And honestly, the numbers here are pretty staggering. First up, let's circle back to that number we mentioned before, 20 million. That's how many Americans are about to see their monthly insurance bills shoot up. And for a lot of them, it's not a small increase. So, what happens when costs go through the roof? Well, some people just can't afford it anymore, and they're forced to drop their coverage completely. In fact, an official estimate from the government predicts that 4 million Americans will lose their health insurance over the next decade, all because these subsidies are going away. But hold on, because the number might be even higher than that. The health policy think tank KFF says that other changes in the budget could push an additional 10 million people into the ranks of the uninsured. You start adding those numbers together, and you're looking at something on a truly historic scale. In fact, one health policy expert, Matt McGuff, calls this, and I'm quoting here, the largest rollback in health coverage in U.S. history. And he points out that this doesn't just affect the people who lose their insurance, it could actually drive up costs for everybody. Because when hospitals have a lot of unpaid bills from uninsured patients, they often pass those costs on to everyone else who does have insurance. And how do they do that? Usually by raising premiums. So this is all barreling towards that 2026 deadline. The big question is, what happens next? Because you can bet this political fight is far from over. Both parties are already making their moves and planning for what comes next. So here's what the road ahead looks like. For the Democrats, they've made this a key issue for the upcoming midterm elections. Meanwhile, Republicans are trying to find other ways to control these price hikes, but without bringing back the subsidy extensions. And President Trump has even floated the idea of meeting directly with insurance company executives to try and negotiate lower prices. So, with that 2026 deadline getting closer and closer, the pressure is definitely on. You know, when you boil it all down, this is so much more than just a line item in a federal budget. It really gets to the heart of a fundamental debate about what our national priorities are. As this financial safety net disappears, the country faces a really tough choice. How do we balance the cost of healthcare with the very real human cost of leaving millions of people uninsured?